While women certainly make up the majority of my practice, but more and more I see men in the office, and this is true nationwide. I think men are catching on to the benefits of not only surgical procedures, but non-surgical plastic procedures that we do here. On the surgical end, certainly liposuction is very common among my male patients. They're often eager to target some localized fat in the abdomen or the hip area. But another area that I commonly treat is the breast tissue in men, and what we call gynecomastia. And so liposuction is a great modality for that. Sometimes I use traditional suction-assisted liposuction, but also we have the option to use our laser-assisted liposuction done in the office without anesthesia, just a local anesthetic, and also our non-invasive fat reduction modality using radiofrequency. Those are very common surgical procedures that I see men for. More and more men are interested in things like BOTOX and injectable fillers. They definitely, just like my women patients, they don't want to look overdone for sure, and there's a way to use these treatments and still appear very masculine, and they want just to look more relaxed, maybe more approachable in the workplace, more refreshed, less tired, and so we can really achieve some nice changes that way. Also, men are, again, eager to get involved with skincare. My esthetician sees lots of male patients, interested in improving the appearance of their skin. Laser hair removal, too, is extremely popular for men, especially in the chest and the back area. Men are learning about some of these modalities on their own, but also they're learning through women in their lives, whether it's their girlfriend or wives. I think there's less taboo about thinking about plastic surgery in general for men and women.